Hi, doctor. I'm Pete.
Hey Pete, nice to meet you. How can I help you today?
Hello. So I was thinking about getting into healthcare. I don't know what I want to do yet. I was kind of thinking about pharmacy, but I have this assumption that you guys only dispense pills at CVS and Walgreens, and that kind of bores me. I'm sure there's more to that. I'm not sure if you can tell me more about your profession.
Yeah, absolutely. And first, I'm glad to hear that you're interested in learning more about pharmacy. But actually, we do so much more than just fill prescriptions inside of a CVS or a Walgreens.
Okay.
In fact, we're the medication experts. We also prevent any medication errors, we check for dangerous drug interactions, and we help manage chronic diseases on a day-to-day basis. But what most people don't realize is that pharmacists actually work in many different settings, not just in retail. Actually, let me show you what pharmacy really looks like.
That's so cool. Let's go.
Oh, I need to speak to the pharmacist.
Yes, I'm the pharmacist. How can I help you?
My doctor prescribed this for my baby's fever and something's wrong. She hasn't gotten any better.
Okay, let me see what the problem is. You've been following the instructions?
Yes, 5 milliliters every morning. I take it every morning and she still hasn't gotten any better.
I'm sorry, did you say you're taking this?
Yes.
So you haven't given any to your baby?
No, I've been taking it every morning.
You've been taking all of this every morning?
Yes, and now the bottle's empty and her fever still hasn't gone down.
Okay, I'm gonna refill this for you and show you how to use the medication correctly.
Okay, thank you so much.
You're welcome.
Hello, doctor. My name is David Montes. I was prescribed this antibiotic. They said it's amoxicillin. I think that's what it's called. I don't know how to take it.
Okay, no problem. This is amoxicillin. It's an antibiotic used to treat bacterial infections. You'll be taking one capsule every 8 hours for 10 days. Be sure to finish all the medications, even if you start feeling better, before it's done. That helps prevent the infection from coming back or becoming resistant.
Okay, so it's for my sore throat, right?
Yes.
Okay, thank you. And then should I take it with food?
Yes, it's best to take it with food or milk to avoid an upset stomach.
Okay.
Drink a full glass of water with each dose.
Oh yeah.
If you miss a dose, take it as soon as you remember, unless it's almost time for the next one. In that case, just skip the missed dose. Don't double up.
All right. Okay. I fully get it now.
Yeah, you're welcome.
I'll take this medication now. Thank you.
Hello, my name is Megan. I'm here for my first day of internship.
Hello, Megan. My name is Dr. Banner. Have you worked in pharmacy before?
I worked in retail before, and I know hospital pharmacy is very different. But I'm not totally sure what pharmacists do here.
No problem at all. I love teaching. So in a hospital, our job goes way beyond dispensing meds. We're part of the clinical team. Every order that comes through here is reviewed for us before it reaches the patient.
What exactly are you checking for?
A lot. We verified that the medication, dose, route, and timing make sense for the patient. We monitor for drug interactions, and we check that their lab values and kidney functions align with what the doctor prescribed. We also adjust medications to account for the patient's weight, age, and allergies. One mistake here can seriously harm the patient, so safety is our #1 priority.
That's a lot more intense than I thought.
It definitely is. We also prepare IV medications, manage crash cart medications, and respond to emergencies. We also work closely with physicians and nurses on dosing adjustments and therapeutic monitoring.
So you're really involved in patient care, not just behind the scenes.
Exactly. We're on the healthcare team just like everyone else. Our job is to make sure every medication is safe, effective, and tailored to the patient.
Wow, I didn't realize pharmacists had such a big role in the hospital.
Most people don't, but this is where pharmacy gets really high stakes. Every decision matters, and once you understand how much impact we have here, you'll never look at pharmacy the same way again. Now let me show you around our pharmacy. Okay, so first off, this is the IV room. This is where we prepare all the IV medications for the entire pharmacy. It is a sterile environment, so before you enter, you will have to glove up, put shoe covers on. I'll show you how to do that in a little bit, but for now, let me show you where the crash cart is. So there's one of these on every floor. It is a crash cart. So what that means is that every time there's a code blue and somebody is in danger of immediately having a medical emergency, we have the medications for that here. So this is where the epinephrine is for allergic reactions and anaphylactic shock. This is also where all our cardiac medications are for cardiac arrest. So this is very important. We maintain all the medications in here, and there is one on every floor. This is where this one is. So make sure to remember that. And let me show you how to work the system. to speak with the doctors and nurses.
Thanks for taking the time to show me around.
Of course.
Hey, help me! Someone help me!
What happened?
He's having an allergic reaction.
Hey, get that epinephrine!
I love him! I need you to save him.
One, more.
Oh, thank you. I shouldn't have eaten those peanuts. Oh, thank you.
Thank you for letting me shadow you today. Could you let me know a little bit more about research pharmacy?
I'm glad you're here. In research, our job is to help create new medications and improve the ones that already exist. We study how drugs work and how the body reacts to it.
Wow, so you actually improve drugs, not just make new ones?
Exactly. We run experiments, test different formulas, analyze data, and if something doesn't work, we just adjust it and we try again.
And do you do clinical trials too?
Yes, we help design trials, check dosing, monitor safety. Our goal is to make sure the medication actually works.
That's very impressive.
Let's put our goggles on, tie up our hair, and get to work. What are you doing?
Curing cancer.
Get back to work.
Welcome, ladies and gentlemen, to this congressional hearing regarding drug shortages. As you may know, drug shortages in the United States have remained a serious and persistent challenge, with over 270 medications in active shortage as of March 2025. The number of shortages has been steady since a record
5 hours later.
of 323 active shortages in the first quarter of 2024, the highest level reported since tracking began in 2001. These shortages have affected a wide variety of medications, including sterile injectables, antibiotics, stimulants, and chemotherapeutics. Many shortages have persisted for months or years, presenting significant public health concerns. When they occur, drug shortages can disrupt care, lower adherence, and increase burdens on both patients and health providers. Please join me in welcoming Chief Pharmacist of the FDA, Dr. Moreno.
Thank you for that introduction. My name is Dr. Moreno, and to avoid these shortages, I propose the Drug Shortage Prevention Act, which basically expands the requirements manufacturers have to report these drugs. To keep our patients healthy, they need their drugs, they need to get treated, all right? So that's why I need you to pass this bill.
Sign the bill, I need my drugs.